Skill 18-1, positioning the patient. We're going to look at Miss Benavides in the bed. She's in a supine position. We're going to look at alignment and safety. I'm going to uncover her neatly. We're going to see that her shoulders and arms are supported. She's in the center of the bed. Call light is in reach. Half rails are up. Her lower extremities from behind the knee to the ankle are supported, and the heels, now you might want to get right in here, are offloaded. No pressure on the heels. Bed is in low position when you're not working with the patient. I'm going to show you a low Fowler's position. Low Fowler's is the head of the bed up 15 to 30 degrees. Low Fowler's position, head of the bed up 15 to 30 degrees. Semi-Fowler's position, head of the bed is up 30 to 60 degrees. If you want to take a shot laterally of the bed. Fowler's position is 60 to 90 degrees. Your 90-degree position is sitting straight up and down as if you were sitting in a chair. When a patient, I'm going to put her back in a semi-Fowler's. When a patient has the head of the bed up, to prevent sliding down in the bed, we can elevate the knees of the bed, but no greater than 15 degrees. Ready? I'm going to explain to the patient that we will be putting her into a left lateral position. We will first of all provide privacy to the patient by closing the door and the curtain. We will perform hand hygiene. We will ask the patient if she has any questions. I would also like to know from the patient if she has any pain before we move her. The patient has pillows for positioning in the supine position, but I also have some bath blankets and an extra pillow for positioning. I'm going to raise the bed to a comfortable working height. And as we lift and move our patient, we will be sure to use good body mechanics by bending at the hips and knees and keeping our back straight during lifts. Is this high enough for you? You can put your rail down. To position a patient, it is necessary to uncover the patient. We're going to place our hands under her extremity to remove pillows. No grabbing of the extremities. I'm going to place my hands under her legs. No grabbing. and place her legs down gently. We will be using the lift sheet. The lift sheet is used to support and lift the two heaviest parts of the body, which is the shoulders and the hips. So the lift sheet, you can see, goes from above her shoulder, just above her shoulder, to just below or behind her knees. We're going to ask the patient, or we will assist the patient in crossing her arms over her chest. We're going to roll the lift sheet very close as you can get to the patient's body. To do a left lateral turn, we need to bring the patient to this side of the bed, the opposite side of the bed, the right side of the bed, so that when she turns, she will wind up in the middle of the bed. We will bend at our knees and hips, keeping the legs straight, and we're going to pull her towards me. Teamwork is accomplished by, on the count of 3. 1, 2, 3. And we did a good lift. Got you over. We're going to make sure that the lift sheet is straightened out and there won't be any wrinkles that the patient will be lying on. I'm going to move her pillow a little bit. Straighten her out. Okay. To accomplish a left lateral turn and the patient will not be lying on her arm, we can take the arm into this position. Abducted, the shoulder flexed with an external rotation. This arm can stay on the chest or it can lie on the bed. Mr. Hernandez is going to take the lift sheet because good body mechanics dictates that you pull, and for me not to push her over, but he's going to pull her over. On the count of 3, 1, 2, 3. I'm going to take a pillow and I'm going to place it behind her back. I want to tuck it in. And I want it to support her so that she stays in the lateral position. I'm going to bring her back onto the pillow a little bit. I'm going to come on that side. All right. You want to make sure, by having placed her arm in this position before the turn, I ensured that she's not laying entirely on her shoulder. If she was, the nurse, you should take her shoulder out by flat hands going up underneath the body and just pulling the shoulder a little bit out. I would like to support the upper extremity, and you can do that by maybe a bath blanket, Mr. Hernandez. to prevent fluid from going down and causing swelling from dependency. The call light is always to be at the patient's side. In a lateral position, I want to bring her legs, I want to flex the hip and the knees. And that brings her more over onto her hip a little bit. And then I want to separate the bony prominences at the knees and the ankles and take pressure off of this toe here. It's lying on the bed. So by placing your hand up underneath the extremity, lift, and let's see how that looks. A double check to make sure that your patient is in the center of the bed, that the body is aligned, the shoulders are level, the shoulder to the hip, everything is aligned. You have straight lines. Always ask your patient if they're able to respond, if they are comfortable. When you've accomplished the position, cover your patient. You want to keep patients warm, but not too hot. Neatness creates safety, and it shows caring by the nurse. Gloves off, pinch off the first one, scoop off the second. Hand hygiene. Till dry. Bed in low position. Now, in a lateral position, you can also use a low Fowler's, lateral low Fowler's, lateral a little bit higher, maybe semi-Fowler's. Patient looks comfortable, aligned, and safe. I will be repositioning the patient into a left oblique. The patient can lie in one position for a maximum of 2 hours. A left oblique takes the weight and the pressure off of the shoulder and greater trochanter. To accomplish the left oblique, I'm going to raise the bed to a comfortable working height. For good body mechanics. I'm going to put the side rail down. I'm going to perform hand hygiene. And don gloves. Thank you, Mr. Hernandez. A left oblique is the preferred position for prevention of pressure ulcers. Because in the oblique position, which is, this is your oblique. and in your obliques, you have no major bony prominences. We're going to uncover the patient so that we can work with her. We will remove the positioning devices. I'm going to pull her towards me with the lift sheet, and we're only going to take this pillow out, away from the body a little bit. There's a little bit of space between the body and the pillow. The lift sheet, we'll straighten the lift sheet nicely. I'm going to lay her back onto the pillow. We need another, let's use this pillow over here. This pillow is going to go for the upper extremity. I'm just going to bring her hip out from under her a little bit by placing a hand under the hip and one above the hip, and just bring her out off of that hip. For the oblique, the dependent leg is kind of straight. This one will be kind of bent. Again, ask about patient comfort, if this is comfortable for the patient. Assess for alignment, the shoulders, the hips, hip to the knee, knee to the ankle. Bony prominences are separated. In the center of the bed, side rail up, call light within reach, side rail up, cover for warmth and privacy, neatness. Bed low. After I remove my gloves, perform hand hygiene. Bed low. Make sure that call light is in reach. You can even put it into the palm of the patient's hand. And if you want, you can give them a little bit elevation of the head